Before starting this video, I wanted to ask you a couple of questions. Are you using anabolic steroids, or do you know someone who abused them for enhancing his/her gym performance? Are you aware what they are and what their actual purpose is? Do you know the detrimental effect of their continuous abuse and overdose? Welcome back to I the Pharmacist, where we explore the fascinating world of science and health. In today's video, we are delving into the complex topic of anabolic steroids. We will uncover the structure, characteristics, legitimate uses, the dark side of abuse, and the concerning side effects that come along with them. By the end of this video, you will have a comprehensive understanding of anabolic steroids. Let's begin. Firstly, what are anabolic steroids? Anabolic steroids are synthetic versions of the hormone testosterone, which is naturally produced in the body. Their primary function is to promote muscle growth and enhance athletic performance. They have a unique molecular structure which allows them to bind to specific receptors in our cells. They bind to receptors in our cell's nucleus. This binding initiates a series of reactions that ultimately lead to an increase in protein synthesis and muscle growth. These receptors in the nucleus of our cells also play a major role in regulating key genes important for organ development and function. These include genes that modulate brain, reproductive system, bone, adipose tissue, metabolic and immune cell functions. The next segment is about legitimate medical uses. Anabolic steroids are prescribed by doctors to treat conditions such as hormone deficiencies, muscle wasting, diseases, and delayed puberty. These drugs can help patients regain lost muscle mass, recover from injuries, and improve their overall quality of life. Segment 3 is about abuse of anabolic steroids. Unfortunately, not everyone uses anabolic steroids reasonably. Many individuals misuse them for non-medical purposes, such as enhancing their physique or athletic performance. It's crucial to understand the risks associated with this misuse. Now let's move to the most important segment 4, side effects of anabolic steroids. These can vary depending on several factors, including the dosage, duration of use, and individual genetics. Some moderate common side effects include acne and hair loss. Anabolic steroid abuse can cause significant physiological disturbances. Users may experience mood swings, aggression, irritability, and even psychiatric disorders such as depression and anxiety. The phenomenon known as roid rage can result in uncontrollable anger and violence. And now I want to talk briefly about the long-term health consequences, which are really important and can be really severe and bad for your overall health. These side effects can persist even after stopping steroid use. Prolonged use of anabolic steroids can disrupt the body's natural endocrine system. The body may reduce its production of natural testosterone, leading to testicular atrophy, shrinkage of testicles, impaired sperm production, and infertility. Steroid abuse can lead to an imbalance in hormone levels, causing an increase in estrogen relative to testosterone. This can result in gynecomastia, the enlargement of male breast tissue. Therefore, many users take aromatase inhibitors. They are a class of medications primarily used in the treatment of hormone-sensitive breast cancer, specifically in postmenopausal women. They work by inhibiting the activity of an enzyme called aromatase, which plays a crucial role in the conversion of androgens, male sex hormones, into estrogens, female sex hormones in various tissues, including adipose fat tissue and breast cancer cells. The use of these drugs is associated with many side effects, including but not limited to an increase in cholesterol levels, a decrease in bone density, night sweats, loss of appetite, heartburn, muscle and joint pain, fatigue and dizziness, and many more. The aromatase inhibitors and anabolic steroids are listed as prohibited at all times on the World Anti-Doping Agency prohibited list. So I strongly recommend you to stay away from these unless you have a specific medical condition when you need to consult with a physician. The next thing that anabolic steroids can really damage is the liver. Many oral anabolic steroids are processed by the liver and their use can strain this organ. Long-term abuse can lead to liver damage, including conditions like cholestasis, interrupted bile flow, and liver tumors. Severe liver damage can result in liver failure and then death. But the bad news don't finish here. Anabolic steroids can adversely affect the cardiovascular system. Over time, they can lead to an elevation in blood pressure, changes in lipid profiles such as reduced HDL cholesterol and increased LDL cholesterol, and increased risk of atherosclerosis, which is hardening and narrowing of arteries. This can lead to high blood pressure, heart attacks, and strokes. Your kidneys will be another victim of the abuse of anabolic steroids. The kidneys are responsible for filtering toxins from the blood, and the use of anabolic steroids can place added stress on these organs. Bear in mind that over time this can lead to kidney damage, including glomerular dysfunction and renal hypertrophy. Another side effect can be muscle cramps and spasms, and the steroid abuse can increase the risks of these. They are involuntary contractions of muscles that can be painful and disruptive. The exact mechanism behind is not fully understood, but it may relate to electrolyte imbalances or alterations in muscle function caused by steroids. Some individuals who abuse steroids may experience joint pain. This can be due to several factors, including changes in the composition of joint fluid and the added stress on joint as muscle grow larger. Joint pain can limit mobility and physical activity. One of the worst things about steroid abuse is connected with addiction and withdrawal. Some individuals who abuse anabolic steroids can develop psychological dependence. When attempting to stop, they may experience withdrawal symptoms such as depression, fatigue, and intense cravings. It's crucial to emphasize that these long-term health consequences can be severe, multifaceted, and sometimes irreversible. Remember, there are no shortcuts to a healthy and fit body. If you found this video informative, don't forget to like and subscribe for more science and health content. Thank you.